Well, I kind of joke about that all the time. Omari, that's what should be part of your pre-participation screening. Is you finish your screening, then you punch them in the mouth, and you say, "Okay, you see, this is going to happen. Now you need a mouth guard, so that doesn't hurt you anymore."
Welcome back to the Sports Dentistry podcast. We're on episode 14. Boomer, we're getting on well, and the sun's back. It's a nice sunny day here. Very warm today. So nice summer's evening. We're almost at the longest day of the year. Things are looking good.
Yeah, things are looking good, and I really look forward to the longest day of the year. And actually, the weather forecast is saying that this weekend should be hitting 33 degrees Celsius in some areas of the UK. Now, that definitely calls for sun cream, and
Yes, definitely.
we'll try and make some good use of the good weather this weekend. But when you're working today, for example, was a grind in the office, and it was so warm in the surgery, and I had the fan on full blast. It was warm, let me tell you that for free. So I went out at lunchtime. There's a big, massive grassy area, Princess Street Gardens. I just went down there, and it was really busy with folk, with tourists. Found a little spot, put my head down, had a little power nap, and then got up refreshed for the second half. But it was a warm day today, so it must be just as warm in Ireland as well, I assume.
Yeah, it was. It was nice and warm. I was joking yesterday. I was in with the British and Irish Lions. They're back in Dublin. They did a week in Portugal, and I was joking with the head medic, Kieran Crossgrove, who's looking after, took over from James. I said, you must have brought the sun back with you. He says, it's brilliant because all the new players are in, and they're saying, is it always like this in Dublin? He's like, yep, it's always like this. So yeah, the sun's definitely out. Dublin's definitely in a lovely buzz whenever the sun gets out.
Yeah, same as Edinburgh.
Everybody's in a good mood. Yeah.
I think it's because it's such a touristy city, exactly, Dublin and Edinburgh. It's definitely an attraction for people all over the world, not just in Europe to come over, but it really does make everybody a lot happier when the sun is shining. And it also gives you kind of an insight into what it's like to live in a climate where it's nice all the time, because there was that period a few weeks ago where it was sunny every single day and you were just taking it for granted. Like every day was sunny, and it really does change people's mentalities and how they feel about things. And I certainly love it when it's nice, warm sunshine, long light at the end of the evening after work. You can come out and you can go and do things with the kids and whatever else. It's really good fun.
Yeah. Although I've never been to Edinburgh when it's warm, it always seems to be cold when I'm there. So I must make a plans to be there some summertime.
Well,
but then you can't plan these things with our weather. You know, you just gotta do a last minute flight whenever the sun's out.
And you're the king of impromptu visits, so you know if you message me saying that you're coming over this weekend, I wouldn't be at all surprised. But we've obviously know that you've got a big trip planned for next week.
I do, off to Washington. Just talking about the long nights, I have a laugh. So I had a laugh at our Portuguese friends, and I didn't realize that. You know the way now it's really long evenings, but then it's really bright in the mornings. Like it's bright 3:30, 4 in the mornings. But it mustn't be like that in Portugal, because the Portuguese guys said they couldn't sleep in Lithuania because it was bright at 4 a.m. and they're not used to the daylight coming in at 4 a.m. I don't know if that was an excuse for their tiredness, but they said it was due to the early mornings, the bright light coming in at 4 a.m. because it mustn't be as early as that.
Well,
further down south.
Well, they're not pulling their curtains, so there was no light coming in.
I'm not sure. I'm not sure what was going on, but that was their excuse anyway.
Yeah, no, it's right, because in the summertime, like there's very, very few hours of darkness, you know. And I remember when I was younger, and we'd play cricket on a Saturday, and we won the game, and we'd go out with the guys afterwards, and you'd be coming home and it'd be light, and you'd be waking up and it was light, and you wouldn't see any darkness, you know. And that's just the way that the summer is here. We are blessed, I suppose. The summers here are incredible with regards to the light, and if you do get good weather. But the contrary to that is just that the winters are just so dark, aren't they? They're so dark, and they're long and they're cold. But still, I think, you know, Edinburgh, Dublin, definitely Belfast as well, some of the best cities to be in all year round. There's always something going on and always something happening.
Yeah, you just have to be used to the rain. As long as you can adapt. I had a patient the other day. He says, I bought like a raincoat that just keeps you dry, but you can make it into a wee ball. So now I just bring it with me every day because you just don't know when it's going to rain. It's
That's
got,
true. Yeah, that's true.
yeah. So as
You
long as
do
you're
get
able to
gadgets like
adapt to the
that, don't
rain,
you? You do get
yeah.
gadgets, and you can just like certainly brands like Rab and things like that. You
Well,
can
he got
take
his,
them with your drone.
his wasn't really a brand because he got his in little. But he
Oh,
said
right.
he said it was great. You can scrunch it into a wee small ball and you can carry it around with you everywhere.
Yeah, no, that's forward thinking from him.
Yeah, definitely. So we had a great episode last week with James Robson. Fantastic character, isn't he? And what a life he has had in the world of sports medicine. Before there was such a thing as sports medicine, before it was known as sports medicine, and how it's developed and how he's helped that develop to what it is today. And great stories and great experience.
Yeah, going from a bucket in water to and a sponge to where it is now, that's a really a transformation and over those course of years and I think we as sports dentists have to look at that and be in admiration of what not just himself, it wasn't just a one man army. The people around him also sung off the same hymn sheet and wanted to drive that specialty forward. And I think we need to do the same. There needs to be, a group and core of people in regions around the world who are continue to bounce off each other and help try and push and promote sports dentistry and how we can certainly become more integral parts of the sports medicine team and become our own specialty in our own right. It will take time, but we need to take some confidence and inspiration from people like James. And I think the other thing with James was he was willing to take people on board and think outside the box, which we need to do as well. And we need to be able to look at other specialties and think, okay, how are we able to work with each other in terms of trying to promote athlete health and improve athlete health, help them with injuries and return to play. There's a lot of opportunities there that I think we need to continue to look at and see how we can take it to the next level.
Yeah, definitely. It's being part of that team and working with that team, isn't it? Just to provide the athlete with the best support that they can, and it's just developing that and developing it to where we just become another one for in everybody's mindset. You've got the physio, you've got the nutritionist, you've got the sports medicine doc, you've got the psychologist, you've got the dentist. That's almost should like hopefully get to a stage where it sort of rings off as part of the athlete support team.
Yeah, and I think another thing I was just thinking about there was you talk to a lot of athletes and they always say that they just want to leave the shirt in a better place than when they first got it. So players who play well and take the position or take a number to the next level, they want to leave it in a better position. And I think, he's certainly done that. He's left sports medicine in a lot better position from when he first started. And now it's up to the next generation of sports medics to continue that legacy and continue to break down barriers and continue to work with the likes of ourselves. And we have to be the same. So hopefully, as time goes on, we'll be able to leave the sports dentistry shirt or organization in a better space, in a better place whenever the time comes to we move on, which will hopefully be years and years away. But that's what we need to strive to do, just to strive to be better, to improve. Every day is a school day, and the best way to learn is for us to speak to individuals like James and other healthcare professionals on this podcast to let people who are listening, have a good insight. And we're very lucky that we're reaching kind of, over 30 countries all over the world. People are listening to this podcast and just seeing what guests we have on and what sort of inspiration that we can give to them.
Yeah, definitely. And our next guest is also another inspiration. One of the OGs of the ASD, as you mentioned earlier. We're on a big trip next week, heading off to the Academy of Sports Dentistry conference in Washington. Looking forward to it. It's got, this will be maybe my fourth or fifth in a row, and it's got to a stage where you're actually looking forward to catching up with people. That because of geographic locations, you only get to see them at this conference once a year. So I'm looking forward to it. Looking forward to catching up with my good friend Dan Brandt, who's a Cleveland Browns fan. He's from Cleveland, and he's a Cleveland Browns fan, so doesn't like the Pittsburgh Steelers. I'm a Pittsburgh Steelers fan, so it's always good banter to have with Dan as well. So, looking forward to representing the. It's good in a way as well to have a day where you just wear your team jerseys, which is something that we can maybe bring into the
Oh yeah,
UK sports dentistry. So it's like I'm not sure. It's one of the days anyway. Maybe it's the last day of the conference. You try to sort of you wear like your supporters. You put your colours on. You put your colours on and you put your team out. So that could be something we could bring in. Is just helps take the mood down a bit of banter and a bit of crack about everyone's supporting the different teams and different sports that they're into. So looking forward to getting over and seeing Washington, seeing. I've never been to Washington, so it'd be good to see the sights of going to watch on the way over. Olympians has fallen. All the Jared Butler, all the Jared, all the Jared Butler
yeah,
movies about the White House being attacked.
yeah.
To get a feel for Washington. So looking forward to going over and seeing the sights and catching up with everyone next week.
Yeah, the next guest, I had the pleasure of meeting him a few years ago when we had the meeting in Harlequins. A lovely gentleman, just really down to earth. And I thought it was really interesting that he's, his specialty is in paediatric dentistry. And it's, again, another avenue which we haven't talked about on this podcast. So it was really interesting to kind of find out how sports dentistry and his role in being a specialist in peds kind of go hand in hand together.
Yeah, it's going to be good. And that guest is Steve Mills, he's quite famous around sports dentistry circles because he is one of the OGs of the ASD. He's been doing sports dentistry from the 80s and he's been pretty active and consistent since then. So it's going to be a good conversation with Steve, and he's a man that has a lot of knowledge and experience in the world of sports dentistry. So it's going to be interesting to hear his thoughts and everything.
Yeah, I think it's going to be good to hear about just what sports dentistry has been like for him since he's been in it for such a long period of time, and to see how he's seen it develop and where he hopefully sees it going. So yeah, this is going to be a really interesting conversation with Steve, and hopefully the listeners can pick up some good information, hints and tips, hopefully, and just his insight into sports dentistry.
Yep. So let's go.
Hey everyone, save the date. The UK Sports Dentistry Association's second conference is happening on Friday the 12th of September at the Voco Hotel in Manchester. And guess what? It's not just about teeth. We're combining cutting-edge sports dentistry talks with the thrill of live sport. Right after the conference, we're heading to Emirates Old Trafford for the England versus South Africa T20 International. Expect a day packed with expert speakers, athlete Q&A sessions, and plenty of time for networking with dentists, sports pros, and athletes alike. Whether you're in dentistry or passionate about sport, this is a day you won't want to miss. Tickets are live now at sportsdentistryuk.com. Grab yours and join us for an unforgettable day. So it gives me great pleasure to welcome on to the Sports Dentistry podcast this week one of, can I say it, one of the OGs of the ASD?
Yeah, sure.
One of the originals.
Well, I'm not actually original, but I'm close.
Close, very close. So I thought it'd be good to get another one of the ASD guys on leading up to the conference now in a couple of weeks. We already had Emilio and Bayan on, and I didn't actually realize how far back Emilio went until we had the conversation, but he would have been around about similar time as yourself, Steve, getting involved. Yeah, so for a lot of people, I've been very fortunate to get to know you quite well over the last few years. For our listeners that maybe haven't heard a lot about you, give us a little bit of a background to yourself, where you started in dentistry, and then how did you get involved in sports dentistry?
Okay. Well, I'm a pediatric dentist, and when I left dental school in 1981, that's why I'm a real OG. I joined the Army for 3.5 years, and then I went to my pediatric dental residency. My chairman of the department there was a fellow named Cosmo Castaldi, and I was in my residency from 85 to 87. Cosmo Castaldi was one of the original founders of the Academy of Sports Dentistry. he made it a point for the pediatric residents to be involved in sports dentistry, to learn to make mouth guards and stuff like that. And I really enjoyed that. My sports history is like everybody, a fan. My sport was baseball, played through college and stuff like that. So I've always loved sports. But then when I got involved as a pediatric dentist with Cause, it kind of grew. He invited me to give a talk in 1991 on baseball because I was his baseball guy. And so I gave a talk to the fledgling Academy of Sports Dentistry that had just been around for about 8 years at that point. And that's when I became an official member. And so I've been involved with the group ever since then. And as a pediatric dentist, my focus is a little different than a lot of the professional team dentists. But I think that the nice thing about sports dentistry is it really does impact a lot more people than you might think on the surface. Everybody kind of pictures, a boxer with a mouth guard or a rugby player or something like that. But really, it goes the whole spectrum of our patient population.
So the baseball connection, let's go into a little bit like that. Did you play a little bit?
Yeah, I played a lot, actually. I played through my school years, and then I played 4 years of college baseball, never professional. Then went on, and when I was in the service, I played on our base fast pitch softball team. And then when I got back to Maine, I played for 15 years in a men's league. And I don't play baseball anymore. My joints can't take it. But I was a first baseman catcher for many, many years. And that is the sport. I think the sport that you turn out to be best at in your own life is the one that you end up liking the best. And that just happened to be the one that I fell into, and I really enjoyed it. So baseball is a big part of my life. The Red Sox have just beaten the Yankees 2 straight, and they're playing again today and this afternoon. So I'm very happy. And that's my baseball life. I've had a glove on my hand for a long, long time.
Is it a bit like ice hockey then when you've got multiple games a season? Because when we were speaking to Byron, he was talking about how many games these NHL players play every season. And it's quite similar to baseball in terms of how many actual games these guys are playing, girls are playing.
Well, similar in one way, quite a bit more in another. Baseball isn't quite the same physical grind that some of those other sports are. So Major League Baseball plays 162 games a year, which is a ton, right? And it starts in early April, very, very end of March, and it goes through October. So those guys play a lot. And minor league baseball, there's multiple levels, just like there are in soccer in the UK. But the lower levels don't play quite as many games, but still it's a long season. It goes from February is when they start training, and then the earliest finishes up around the beginning of September. And Major League Baseball has been 162 games for a long time. It's a lot of games.
That is a lot of games. And when you obviously touched on how you're a pediatric dentist, so can you just go into a little bit more detail about being involved with pediatrics and working with children and how sports dentistry engages with that?
Yeah, it's something that it's kind of funny because like I said, a lot of people do picture sports dentistry not necessarily being pediatric dentistry, but I was lucky with Cosmo Castaldi to kind of get that connection. And there have been a lot of really important people that have also made that connection. There's a couple things. First of all, Jen Andresen, when he was alive in his talks, he would start them off by saying, pediatric dentists, we're the ones that do trauma. We do more dental injuries than any other specialty. Maybe not severe injuries, but we do. It was not uncommon for it to be at least a weekly occurrence in my office that someone would come in with a traumatic accident. Then once you have a traumatic accident, then you want to protect them and you want to protect other people from getting them. And that brings you into working with youth groups and trying to get them more involved in prevention. And that's what Cosmo did early on. He was one of the movers and shakers of trying to get amateur youth ice hockey involved in protective equipment because of the youth that are involved. And that was both head facial protection plus mouth guards. And that's where we think we see so much trauma. We want to encourage them to prevent this trauma. And so it's just a natural occurrence. And then we are the reference, or we're the referral people for people that need to ask questions when they want to make decisions for their sports organizations, whether it's for youth, which is the most common, or further up the chain too. So pediatric dentistry and sports dovetails very, very nicely. It's different. We don't have the same complexity of restorative dentistry. We don't deal with traveling professional athletes or anything like that, but we deal a lot more with prevention, a lot more with rulemaking, and we do see a lot of trauma. So we have a certain expertise that other people don't have just because we see it so much. For example, like doing pulpotomies on permanent teeth, to a lot of people that might feel a little funny, but to us, it's like falling off a log. We do it quite a bit. And I've had people send me kids that have avulsed teeth, and they put dentists who just say, Steve, I just don't do this that much. And so they'll send it to us because, we do it. So it's kind of a natural fit. It's just a different focus on where you're coming from. I can't treat adult athletes. Well, I could do the emergency treatment, but I can't treat adult athletes definitively just because I'm a pediatric dentist. But I can deal with the acute injuries. My focus was up through college age. I was a team dentist for our local small college here, and that is kind of where my level stops. So I can't do the adult stuff so much. So I've never been a professional team dentist other than make mouth guards and stuff like that. But I have worked with lots of teams on the lower levels, which see just as many injuries in some cases as other areas. Maybe not like professional ice hockey seems to be the outlier. Their dental injuries seem to be really, really high. But for all the other sports, it's not that dissimilar between the two, children versus older adult athletes.
You have done a little bit of work with the Olympic teams as well, with the ASD Olympic, ASD and the Olympic relationship. Can you tell us a wee bit about that?
Yeah, well, that was started by Rick Knowlton when he was president, and he made that connection with the USOPC. It was the USOC at the time. They've added the Paralympic to the designation. And that's been very exciting. It started by us offering them our services largely to make mouth guards for athletes that wanted them and to be a resource for problems as they occurred. But it has kind of developed a little bit more. We've become part of the USOPC team, if you will, and several of our members have lectured different members of their group on oral health and its connection with overall health and all along those lines. We still do mouthguard workshops, but we have become more of a resource for things that you guys started in the UK, which is more of the oral health connection, because a lot of people don't know. Let me just explain for a second how the USOPC works. We have nobody, except when it gets really close to an Olympics, that is an Olympic athlete. Those individuals are covered by their national governing bodies. For example, we made mouthguards for bobsledders. Before the Olympics, there are no Olympic bobsledders, but there are people that the national governing body of bobsled and luge consider their elite athletes. And the national governing bodies have their own staffs, have their own medical staffs and things like that. Now, John Finoff is kind of the head of the United States Olympic Paralympic Committee, and he has tried to kind of embrace these national governing bodies along with the USOPC. And so we've been able to connect with them. And one of the times we were there, one of the guys actually said, you guys are really valuable when we have a problem, and we've been really grateful when one of our athletes needs some dental care. And that's the way they looked at us, is that we were there as needed. But what we wanted them to know is that we are there because you may not know you need us. The oral health connection, bringing that in, making your athletes aware of these things, being a resource to you, not just when you need us for something acute, but for something else. And we've developed a really, really good relationship. And Wayne Nakamura and Kento Chai and Darren Ishikawa and Jared Mosley, those are the four that have really stayed connected. And our connection is really very strong. And they look at us like we're really weird because we will go do these mouthguard workshops, basically nothing on our own time, just because we like it. And none of the docs do that. They don't do anything without getting paid. At least it seems that way. I shouldn't say that, but it seems that way. But so they look at us like, okay, these strange dentists, they'll come all the way out here to Lake Placid to make mouthguards, and we don't have to pay them a cent. So they really like us. And I think that our message is getting through as well.
Yeah, and there's different challenges, like obviously in the US compared to like the Irish Olympic athletes. So there's one centre, the Institute of Sport, and they would provide the sort of medical support, a little bit like the Institute of Sport in the UK as well. But you're saying it's slightly different there, where you have your Olympic centres, you have your Summer Olympic Centre in Colorado, and then Lake Placid, that's the Winter Olympic sort of centre, is it? Is that the two main centres?
Oh, the two main training centers. Yeah.
No.
There are others that are not official. There was one in San Diego, but it kind of got taken over, but it's still very active.
And so before, would them centres only really be active in the lead up to an Olympic Games, or are they used by these national governing bodies throughout the 4 years cycle?
Yeah, no, that's very interesting. Actually, the national governing bodies will cycle their athletes through the training centers all throughout the year. The last time we were in Colorado Springs, we worked with wrestlers and boxers, and they came for a 2 to 3 week period, and then they moved on. And then the USA team swimming will rotate through Colorado Springs. And so they have a relatively quick cycle. They're active all year, but these different national governing bodies will bring their teams through on some sort of schedule. So there's always something going on, but they're always different sports. The same sports don't cycle through there all the time.
Yeah, and the US as well is slightly different, where especially when it comes to Olympic sports, is that colleges are very active with a lot of the Olympic sports, the likes of the athletics and things like that. I know like a lot of the good Irish athletes and the UK athletes, they will go to a US college because it's a really great development pathway there. Is that what happens with Olympic sports as well, that the sort of colleges will look after a lot of the development for that athlete?
A lot of that happens, yeah. For example, let's take track and field, okay? The U.S. colleges are very active, in their sports programs, but leading up to the Olympics, there will be a U.S. Olympic trial where the athletes kind of compete for spots on the Olympic team. And when you watch these, most of the athletes seem to be coming from a background of a collegiate school. You will see a lot of these athletes wearing UCLA gear and things like that. And all of the, so yeah, I think that's one thing, John, that I've noticed more than anything is the school development program in the United States seems to be a little different than it is in other areas. And you guys can comment on that for me more than anything. But the school base is starting from like 12 years old. Before 12 years old, it's mostly community based, even with larger organizations. Like USA Soccer will oversee everything, but all the programs are community based. But then once you hit what we call middle school, that seems to be the most active as far as sports all the way through college. So it is kind of like a training program starting at age 13 and going all the way through collegiate ages. And so, yeah, the colleges are largely training programs now, rather than, we don't have a minor league for track and field, for example. We have colleges. We don't have a minor league for American football. We do have several leagues, but we have collegiate football. And same thing with basketball. There are lower level basketball leagues, but not as many. But we do have really active college basketball. And a lot of those guys will go from there to the pros. It's confusing now because the USOPC allows professionals, so it gets a little bit weird as to who is what. But yeah, you're absolutely right. The collegiate feeder program for different sports is really huge. College sports in the United States is a big deal. And that is where the elite athletes usually start off.
So then as a sports dentist, it's almost, that's where we want to try to make an impact, is it, in with the schools and the colleges, and try to get our message across to our athletes that way? Would that be a way of their approach in the US that might be a little bit more successful than other countries?
Probably. And largely our cooperation in the United States with schools, whether it's high schools or colleges, and believe it or not, their athletic trainers, what do you call it, physios there?
Yeah, physios.
And the National Athletic Trainers Association. That's probably our biggest growth factor to get people involved and understanding sports. The athletic trainers have been our best partners. Sports medicine people, they're interested, but not in the same way. They don't deal with athletes in the same way. Whereas our athletic trainers are the closest people to the athletes. So yes, you're absolutely right. You want to, the schools are fine, but our connection with the schools is kind of like a partnership almost always between athletic trainers and ourselves and the athletes. That triangle, if you will, as far as dentistry goes, has been really, really useful.
Well, it's interesting. You made a really valid point about it's not until the problem arises and then the medical staff or the physio get in touch with you to help deal with what the situation is. And then they realize, actually, we need these guys, or we need this specialty involved, because it becomes out with their comfort zone. And it's something that we've discussed on the podcast before with our guests. It's that you need a little bit of luck for you to get involved. Something needs to happen to an athlete or within an organization for them to actually stand up and take notice that actually we need this level of care or level of help from people who are more educated in that realm. For us, which is dentistry, which is sports dentistry. So you mentioned there about you feel that the medics maybe not as heavily involved, but you get more support from the physiotherapists. Why would you think that would be?
I think that the athletic trainers live with the athletes, and they do every part of their life centers on the athletic trainers, whether it's their protective gear, tightening knee braces, or giving them things to help them heal, or giving them protective equipment after injuries or before injuries, and then seeing them every day, on the bench, so to speak, or where they are. They're just very, very close to them. So the concept of prevention is more real to them than I think it has been my experience is to all of the docs. Now, that's changing a little bit. Again, this is kind of like old person perspective maybe, but when I first got started with this and you would talk to a sports doc, it almost always was an orthopedist. And it was almost always the person that would treat their knee injuries or their joint injuries or something like that. And the team physician was almost always an orthopedist. But that has now changed. It's almost always a family doc or an internist or something like that. Someone that looks beyond just the joints. And the orthopedist is still super important, but obviously they have their niche now. And it's not just everything. Whereas the family doc or the internist is looking at the whole athlete. And we're part of that. And we're getting a foothold, largely like with what you guys are doing. But even here, and we're starting with the USOPC, but even here, it's not that easy because people don't look at their teeth in the same way they do at their joints or their heart or anything like that. But it is starting. And you're right. A lot of times, what we'll find is that we'll do a mouth guard clinic for a school or a high school or whatever, and we'll find dental problem that we didn't know of before. Whether it's a hole in a tooth or a semi-erupted wisdom tooth or something like that, where we could point that out and start to say, hey, screening is important. I mean, there is a pre-participation screening position statement from our national athletic trainers, but they don't mention an oral health screening at all. And, we kind of have pushed that. I mean, I know the European group has a pre-participation thing that they worked on with us, which is great, but the total acceptance of that is a work in progress. It's getting there, but it's a work in progress.
It's interesting you should say that because, I mean, you've been around the game for such a long period of time yourself, Byron, Emilio, but you're still saying things like we're only just getting started or we're still very early in our infancy, maybe not to the same words to that extent, but you certainly feel there's still a long way to go. But you would think after decades and decades and decades of people being around that we would be a bit further ahead. So when John and I kind of look to the future and think where can we take this, and really the sky's the limit because we still feel and we're still hearing from very experienced people like yourself and also here in the UK that there's still a lot to be done. So what do you think needs to be done, certainly in the next kind of 5 to 10 years, to kind of take us up to the levels of where the sports medics are now regarded in terms of having their own specialty? What needs to happen? What needs to change for you to then see your vision from years ago to then start to come to fruition?
That's a good question. It's a big question. I think that the ongoing integration of us as part of a sports medicine team, not an isolated injury treater, is probably the best thing. And so what's happening with the USOPC, whereas we're being asked to give lectures to the sports medicine people, not on recognizing injuries, which they really like, but on overall health concerns, is probably the direction that I want to see continued more. The mouth guard thing will always be near and dear to us. That's what we do. And as dentists, we like doing stuff, I think. But I think that in order for us to continue to progress, that integration with the sports medicine community is probably something that it's continuing. It's not like we're just getting started now. I mean, the symposium that I first got with you was 2014 based on 2012. So, it's been around for a little while now and it's getting better, quite a bit better. But there's, I think that's the direction that we have to continue to work with, is to continue to work with dentists being as much of a sports medicine team as an orthopedist or as a dermatologist or as a sports nutritionist or something like that. And then we can get our overall oral health message to the people where we're not looked upon as being different than other people. We're part of the same group and we kind of want that to work that way. Injury treatment and injury prevention will always be our backbone. There's no way around that. That's a message that's going to be kind of impossible to break from my standpoint for a long, long time. And it's an important message, but for us to progress, we have to be looked at slightly less as a separate entity.
Yeah, it's trying to build us as part of one of the athlete medical team, where it used to be just a physiotherapist or the athletic trainer was the athlete medical team and maybe pulled in a few specialists when needed. Where now when you speak to some of the teams, the types of support they have the physio, they have the doctor, they have the psychologist, they have the nutritionist, they have the masseuse. It's almost like we should be one of those names whenever you're talking about the athlete medical team.
Surprised to me that pre-participation evaluation is not as routine as it should be. I don't know why it's not that difficult to do. And some places do it, like Jeff Hoy always did it with hockey, and I'm sure a lot of hockey people do it, but it's not common at the collegiate level.
But I think it's down to the importance of the people, the decision makers for that athlete, for example, the athletic trainer or the doctor, because I know even in circumstances where the athlete is being requested to have a dental screening or dental clearance, for example, athletes before they go to Olympic Games are requested that they get a dental clearance. And I know from speaking to Irish Olympic athletes that box was just ticked, that they weren't actually sent for their screening to get the OK, that box whenever the application was going into the IOC for registering that athlete, that box was just ticked. So it's maybe that decision maker that we need to be talking to to help that message get across of the importance of doing these screens.
Hey, can I ask you guys a question? Thinking about this and the importance of us. When I was in Twickenham, what was that, 3 years ago now? 2 years ago?
Yep.
Yeah.
Whenever it was, I would talk to, well, I can picture it. I was speaking with one team dentist of the Twickenham Rugby Club. And it was only recently that she was allowed pitch side or even went to every game. At the higher levels now, do you guys generally have team dentists at the higher professional levels that show up for every sporting event like they do here?
Now, Steve, you're gonna open up an opportunity here for the Scottish team to start bragging again, because because apart from the great work that's been done in Scotland, where it is a regular occurrence, it's very ad hoc everywhere else in the UK and Ireland. Yeah.
Well, you got a great start, and you got an empty white sheet of paper to start filling in there, except for Scotland.
Yeah, I think we've been
the-
very lucky. We've been very lucky,
Yeah.
and we've had people on the podcast talking about this, that we've been very well integrated into the sports medical team over years because of a few certain people like Fiona Davidson and James Robson. And you know, that legacy continues with the younger generation coming through and the new medics that are getting involved. And it boggles my mind that within the home nations of us, Ireland, Wales, and England, it's really only the Scots who are at every single international home game for men's, women's, and under 20s. We're talking about rugby at the minute, kind of contact sport wise. And the lady you're referring to, Annie, is involved with England, and John's obviously with Ireland, and our other colleague Lyndon, who's the Welsh. To be fair to him, he does get to a few games, but a lot of it does come down to the value that's perceived of the dentist to be part of that medical team. You talk about multidisciplinary approach and having the team involved. A lot of it comes down to the people who are higher up, who get paid for these decisions, to see the value in having somebody like a sports dentist in part of the team pitch side on match day. That's again still some of the challenges that we're having here in the home nations. Obviously, speaking to colleagues out in America, it seems like a lot of the medical colleagues do find it a bonus to have somebody with expertise like yourself being potentially pitch side and having more of a hand-on experience, so to call it.
Yeah. No, it's kind of interesting because, well, in DC, John will be going to the soccer match of DC United on Saturday night, and Emilio goes to every single game. And if he can't go, there will be a dentist there, and that's both men and women's. And soccer football in our country is not as important as the other sports, and the other sports all have a dentist at the facility for every single game. Now, that's at the professional level. At the collegiate level, they also do, but only at the higher levels. Where I worked at a small college where I am, I didn't go to every game. I was a speed dial on their phone, but that was about it. But yeah, I think that you do have a ways to go. Again, until your presence is there all the time, your importance is kind of downplayed. Once your presence is there all the time, people know, okay, he's important because he's here all the time and he has a role for us. But so, yeah, I guess you do have some work to do, but I mean, it'll get there.
Yeah, it's interesting because Emilio has done a great job. We spoke to him and he explained how he came off the 1994 World Cup, and now he has this really good setup with DC United. But now that when FIFA come in next year with the World Cup, they don't see the value in having a dentist pitch side. So it's not, there's still, as we talked about, a long way to go. And even sometimes it takes, and Emilio was saying it, that's probably down to the fact that us as dentists haven't highlighted our need as much, that we'll just go in and we'll help and we'll get the players sorted. If they've had a traumatic incident, we'll get them the treatment, and we maybe don't record it and get that importance displayed higher up to make sure that for future scenarios that the dentist is involved. And it's even like, as Umar says, in Scotland, they have someone there all the time, but it might take like an incident. So for example, the rugby player that I asked for your advice on last year that I was involved in helping, their club is now looking at setting some sort of setup next year for having pitch side support. But that's only come off the back of a serious incident that happened to one of their players. So it's almost the work that we need to do to try to get in before an incident happens for them to actually show value in what we can offer. So that's the work that we probably have to do.
Yeah, no, and there's a lot to do. And you know what? Dentists are not up to speed yet either, because Emilio is very unique because he brings a passion for the subject along with a passion for the team and the sport. And he has tried harder than anybody else to grow it. But let me give you an example as to how we have to teach our own people. You know, I've met Peter Fine, and he has a fairly rigorous course on sports dentistry. Well, wouldn't it be nice if every team dentist had taken that course so that they were an expert in that? Well, in our meetings in the last 2 years, I met a lovely couple from Houston. They moved to Houston and they bought a practice. And that practice covered multiple professional sports teams. They had no experience doing sports dentistry at all, but all of a sudden, boom, they are now team dentists at the professional level. There was another student that we were involved with. He left his school when he graduated. He went into residency and he was going into a practice that did a professional team. And so, boom, he was going to be a professional team dentist. So what we have to kind of do, in addition to educating our sports medicine people, is we have to make sure, as Emilio has tried, that the people that do interact with these teams are actually really knowledgeable as to what we do. You know, sports medicine is a real field, and there are sports medicine fellowships and things like that. But outside of the UK and Japan, there are very few sports medicine groups, and they don't produce individuals in any numbers. So a lot of the sports dentists that are here in the United States at all levels are just sports fans that are good dentists, but they don't see us as anything other than injury treaters and mouthguard deliverers, which is where we started, but we've grown from that. So we have more work to do. We're a small niche, and you know, it's not like, okay, we've been working, you know, Omar, you're right, we've been working at it for a long time, but with the number of people that we have here and the impact we have on organized dentistry, we would never have expected it to happen overnight. But I would like to see Emilio's type of messaging moving forward a little bit more, that when you get to be a team dentist, you're supposed to know, you're supposed to have, or you're supposed to be working towards gaining a sort of specialized knowledge in this particular area. And we have a long way to go on that.
Yeah, no, I completely agree with you. I think for somebody to state themselves as being affiliated with certainly professional and elite level athletes, you have to have some extra training involved, whether that's a diploma or a master's or whatever it is, or show the intent of you trying to learn extra stuff. Because I think the biggest thing that's been for me to get to where I am now has obviously been the masters that I did with John and Peter at UCL, Eastman in London, but it's also been the pre-hospital care course that's run by Scottish Rugby under the umbrella, which is called Scrum Caps in Scotland. But it's being able to sit pitch side with the medical colleagues and be able to deal with acute trauma. I'm not talking about dental trauma. I'm talking about kind of trauma of whether it's concussion, whether it's extrication of players, because the medical staff, the physios, they need to know that you've got that level of training so they can trust you to be able to come into action if you need to. And I think that goes hand in hand with having that additional training when it comes to dental trauma, specifically pitch side kind of field of play role that I'm talking about in a minute, not education and screening and prevention. We had the wonderful Serpil Jamal on, who's the head of Dental Trauma UK recently, and she was amazing as she went through quite a few different types of dental trauma in adult dentition and in a adult patient, for example. With you being a pediatric dentist, can we just go through potentially some of the more common injuries that you see in pediatric dentistry and maybe how you would deal with those sort of traumas? So if there's in particular something that springs to mind, or a case that you have that you can share with the listeners? Because I took a lot away from listening to somebody in their expertise, and it's ingrained now in my head. So I don't have the fear now of being like, okay, God, what's happening? But because people listening to you now will be able to take on something or information that you have in terms of some sort of acute trauma in the pediatric field.
Well, I think the biggest thing about acute trauma in pediatrics is realizing that we have a great healing potential, more than we used to think. And again, going back to Jens Andresen, he gave a great lecture once right before he passed away on his dream. And he talked about pediatric dentists, and he said, we love pediatric dentists. He was talking about, this is weird. He was talking about cells after a dental trauma and how they viewed the dental profession. And the cells around an injured tooth viewed pediatric dentistry very positively. They said, these guys are so gentle, and they're so willing to let us heal. And I think that's probably it, as much as anything, is to put things right, know how much time you have, and then to give the body a chance to heal. We have members who still, if a pulp is exposed significantly, will immediately go to endodontics, full endodontics, whereas a pediatric dentist would never probably view that as a first course as opposed to a pulpotomy, which is in the guidelines, but still, that's what people do. And a lot of general dentists are really, really successful at complete endodontics, and it's a permanent restoration, and it would be good. But for us, we think about healing first. So you take, for example, we had a soccer accident where a goalie went up and punched the ball away and punched the kid in the face, and he luxated the two central incisors, and we put them back and we sutured all the tears around there. There were no fractures or anything. But rather than splint them for the appropriate time, in this case, it would have been 4 weeks, but the end of that time, our guidelines say we can go immediately to endodontics with a severe trauma like that with a closed apex. Well, in pediatric dentistry, you probably wouldn't do that immediately at the end of the 4 weeks. Here's a guy that you might want to get on sometime. Pediatric dentist who has become really, really internationally important, Nitesh Tiwari from India. You may know him, but he was part of writing the old guidelines, and he will be part of writing the new guidelines. And he gave a very interesting talk that I recently saw that said, when you have, even for adults, if you have a luxated tooth, 60% of the time, or a majority of the time, that tooth will become non-vital. But he said in his work, he found that 40% of the time, it actually was okay. It didn't become non-vital. So even though our guidelines say you can go immediately to endodontics, he's saying, well, do you really have to do that? You got a 40% shot. That's like not nothing. And for a pediatric dentist, that's probably our mindset is, can this heal? Can this work? And then where do we go from there? The other thing that the new guidelines that he has said is already working on is they're going to deal a lot more with timing, which, John, I don't know if you've been able on your podcast to describe your rugby accident, but what you showed me is a really good example of that. You were put in a position where a guy had an injury, but his life was such that the timing of your treatment might not fit into his life. And so what you do from a timing standpoint, as it relates to how successful your ultimate treatment will be, is kind of really important. Luckily for kids, we don't usually have that problem. Kids aren't shooting all over the world with rugby matches. So I usually can see them in 2 weeks, 4 weeks, or whatever. But, that's the biggest thing. So I guess the biggest thing for me is the ability of kids to heal, being really gentle with what you do, and kind of not jumping in too quickly, because it has been amazing to me on the ability of the body to heal given some of our newer technologies, like MTA for external root resorption, whether you can turn that around with pulp sterilization and then MTA or something like MTA, biosilicate or something like that. And so So I guess that's it. And then the hardest part with kids is trying to convince them that they need to protect this injured tooth once it's been injured. Getting a 9-year-old to wear a mouth guard because he fell on the playground and hurt his tooth. But now you tell him, okay, well, now that you got this hurt tooth, now I'm going to want you to wear a mouth guard when you play Little League Baseball. Ugh, that's not always easy, but it's something else that we do. And dealing with parents is another big thing that you guys don't have to deal with. Dealing with parents has their own. I've had parents ask me, the kid had a luxated tooth, and this kid was like a 6th or 7th man on his high school basketball team. The basketball team was like 2-12, so they weren't very good. So he got a luxated central incisor. So I splinted it. I told him to come back in the appropriate time. And I said, and you really will need a mouth guard. Well, like within hours, the father called me back and he says, well, can he play tonight? I said, well, yeah, he can play tonight, but I mean, it is a tooth. His arms and legs will work, but how much do you want that tooth to heal? Oh, well, it'll heal, right? You got it splinted. So parents can be tricky. How did that rugby player's tooth ever work out for you?
He hasn't come back for his follow-up.
That's what I hear more than anything from professional practice. Is their terrible patience.
Yeah, so I'm not sure yet. I haven't got a phone call to say they fell back out, so
yeah, right.
That's a positive.
Well, Umar, John and I were talking about this rugby guy that got a tooth avulsed. It was a canine, wasn't it?
He got his canine on his lateral, and his first premolar was laterally luxated as well.
I can count on one hand that many canines that I have treated that have been avulsed. But Umar, I told John that he should present this case to the International Association of Dental Traumatology because it's a good crossover between sports dentistry and trauma. But if you have zero follow-up,
yeah.
You have to have at least.
That's the difficulty. Yeah.
I think
because it'd be over a year now. It's over 12 months since the injury, so it was probably around July time. No. We removed it before he went away. Yeah. It went off before he went on tour, and then we finished up the treatment when he came back. But I haven't seen him since July, so from a follow-up perspective, I'm not sure how well everything's going. But that as soon as they get out of pain, and interestingly, in that case, it was in that incident he had his upper right 2, upper right 3 avulsed, and his upper right 4 was laterally luxated, and that's what the focus was because they were the ones that were splinted, and the focus was on treating them. When I did the final X-ray after we did the root canal on the 2 and the 3, we seen a fracture on the apical third of the root of his central of his number 8 of his upper right 1, which we had missed because the radiographs all had been focused on 2, 3, and 4, but it was only at the end. And then I was like, "Do you think that happened in the same incident?" And he's like, "Oh no, I got an incident years ago, and that's probably happened." So as soon as these players are pain free, fine, they're happy just to keep going. So what is interesting is what I have noticed from watching him play is he now wears a mouth guard. He never wore a mouth guard ever, and then since this incident, because I have provided him with mouth guards, he is wearing the mouth guard. So at least he hasn't progressed. He hasn't progressed, I don't think, to wearing the IMGs because they're a little bit bulkier. But at least he's moved from no mouth guard to a mouth guard. But it's surprising it takes something as serious as that to get buy-in from athletes sometimes to wear a mouth guard.
Well, I kind of joke about that all the time. Omari, that's what should be part of your pre-participation screening is you finish your screening, then you punch them in the mouth and you say, okay, you see, this is going to happen. Now you need a mouth guard so that doesn't hurt you anymore. This is terrible. That's another good thing about pediatric dentistry, right? The parents will bring the kids back. Whereas once the kids hit college and they're away from home, then they're like that. No, I'm good. It's all set. You've finished. I don't need you anymore.
The take home from that for me there is the power of healing you're talking about, Steve. And we know that the liver has an incredible ability to heal as well. And John and his liver needs a lot of healing power, certainly at conferences.
It does. It does take longer to heal. As you get older, the healing time does take longer in all parts of your body.
That takes us on quite nicely to the American Sports Dentistry Conference in a couple of weeks' time, which we know John's going to. Can you just give the listeners a bit of an insight of what to expect in those few days in Washington?
Yeah, no, it'll be a good conference. The first day, which is not part of the conference, is what is it called? Bridging the Gap, a potential thing where we have Raj.
Yeah.
He gives a talk about jaw stability, and he uses a lot of instruments to try and fine tune his ability. And it's really very fascinating. It's not, as a pediatric dentist, it's not something that I would be delivering to my patients probably, but still it's an interesting part of the sports dentistry world. Then Thursday is the hands-on or the more practical portion of our team dentist course. We have a team dentist course. It started as a one-day thing, which wasn't very satisfying, but at least it got people an introduction into it. But they've added some online component now to it. And on the Thursday before, they have suturing workshop, mouthguard workshop, and some minor things about those. And I think that even if you're not going for team dentist certification, if you wanted to take a suturing or a mouthguard workshop, you probably could sign up for it. Then the actual conference is Friday and Saturday. And the highlights to me of that this year is, well, Nestor Kohenka is giving a half-day workshop on dental trauma. Now, Nestor was in 2018, I believe that's the year, was president of the International Association of Dental Traumatology. He also is the inventor and the main person behind the Tooth SOS app. You guys have that in the UK, right?
Oh, yeah.
Yeah.
And that has been very useful. I'll tell you, I gave a lecture to the sports medicine fellows at our local teaching hospital, and I saw the director of that residency about 3 months later, and she said, "Steve, I got to thank you for that. I've already used it 3 times." And Nestor is also probably the world's expert on decoronation, which is treatment of ankylosed teeth to allow the bone to stay at the proper level. He's done more of them than anybody else, but he's an endodontist and he's done a lot of things. So he will be a quality speaker. We have a speaker on TMJ injuries. We have a speaker who is actually quite an expert on concussions, which I find to be an interesting topic, a very developing topic, and she will be great. And there's a couple others, I can't remember all of them, but that's what will happen in day 1 and day 2. Social events is just, what they are. We have a very good silent auction if you want to buy gear from different teams all over the country and things like that, and that's fun. And DC itself is great. And then Emilio has worked it so that a certain limited number can go to the DC United soccer to football team's game on Saturday night. Now, Emilio will be pitch side, but he'll come up and visit with us, and I'm sure he got us great seats and a great situation there too. DC, if you've never been, is a great city to visit. The Smithsonian has multiple museums. They're all free to the public. You just walk in and walk out, and they're all very self-contained. And the hotel we're in is the Willard Hotel, which is, I'm sure that Emilio went into this as well, is one of our historically famous Washington, D.C. hotels from many, many years. That's where the term lobbyist started, because politicians would meet in the lobby to speak to different people about issues and things like that. So it promises to be a very, very good quality meeting in a very, very good venue. And I'm looking forward to this pretty much more than I have the past several years, which turned out to be decent meetings. But this is more of an old school meeting with an eye to the future, which meaning that we're going over the basics because that's what a lot of people need updated on. But we have an eye to where this is going as well. And I'm really excited about it. If you've never been to Washington, D.C., it's a unique place, and it's a fun place. And we're situated in a very, very walkable part of the town. So, it looks like a very, very excellent meeting.
Yeah, I'm really looking forward to it. There's always something you can pick up with the presentations. Actually, something I want to maybe chat about is presentation a few years ago at one of the ASD meetings about how they changed the design of the helmet in baseball of the batter to protect the jaw. Can you remember that one? I think was it in Nashville, and the lecturer spoke about how for jaw injuries from the ball hitting
Right.
the batter, like they redesigned the helmet.
Yeah, it is kind of interesting. This started with a fellow, some years ago now, well over 20 years ago, a guy named Terry Steinbach played for Oakland. He was the catcher, but he got hit in the face with a pitch ball, and he had a flap design. It's called a C flap off the side of the helmet that faces the pitcher. And that C flap he used for a long time. It never really caught on. And then again, less than 10 years ago, an outfielder for the Cubs, I think he played for the Cubs then. Anyway, his name was Justin Hayward. He got the same thing. He got hit in the face with a ball and broke his jaw. And he started wearing a C flap. And that seemed to be the impetus. And now I would say, if not a majority, almost most of players are wearing this C flap design. Now in youth sports, as I've seen in cricket, a lot more players are wearing cages. And the reason for that is that in the major leagues, everybody has their own helmet. Whereas with minor leagues, whether you're left-handed or right-handed or whatever, you have a group of helmets for the whole team. So you have to make it so that it could be both sides. And so now more players are wearing cages when they're batting at youth leagues. In girls softball, which is a very popular sport here, girls are wearing a cage, not C-flaps. C-flaps are really used mainly for baseball and mainly at the higher levels. At the lower levels, they give you a little bit more protection. But in girls softball, they're wearing more cages for batters. And softball is a unique sport. I don't know how many of your listeners know the difference, but baseball, the distance from the pitcher to the batter is 60 feet. And at the professional level, they throw like 90 miles an hour. Whereas in softball at a high level, the girls are only 45 feet away from the batter, and they throw very fast. They throw at least 60 miles an hour, some of the better pitchers. And so it's very hard to get out of the way. But in girls softball, they're also wearing these cages in the infield because the field is quite a bit smaller and the ball is hard too. So it has taken injury for these things to become popular, but yeah, they are steps in the right direction. And it's kind of an interesting development there. It has nothing to do with the teeth, but it does have to do with the jaw. And people do get hit in the head with baseballs as they do in cricket matches as well. Cricket balls tend to be a little bit harder than baseballs, but they're both very, very hard, and they can do some damage. And so that's what that is. It's called a C-flap. It was designed a long time ago by an orthopedist in Atlanta for this guy, Terry Steinbach. But then he started it up again with Justin, and now it's pretty commonplace. I mean, I think most people wear it.
Yeah, it's interesting. So they're using the design of the helmet to help protect from facial injuries. I'm presuming the use of mouth guards in these sports is minimal.
Non-existent.
If at all. Non-existent.
There are, that brings up an interesting point that you would know, John, is that if people are using intraoral appliances, every now and then you'll see someone wear something that you would consider a performance-enhancing appliance. And whether it's a pitcher or a batter or in other sports. So every now and then you'll see that. But the actual players who are wearing a traditional mouth guard, even though they may have been injured in their past lives, is pretty much non-existent in baseball. I'll tell you a funny story. My local high school here, the coach was a health teacher. And so for about 20 years, he and I would have the team captain call my office, and the team would come in and I would make them mouth guards. And he made sure that all of his girls had mouth guards, and it wasn't a rule. So he said, look, I'm not going to make you wear them, but I'm going to make you get one. And he got to the point where most of the girls were wearing these mouth guards while they were playing. Well, it took over And these cages became very popular. And in girls' high school in our area, you have to wear a cage if you play an infield position now. So that they don't wear a mouth guard anymore because they wear cages. And so my mouth guard for my local high school stopped. But for a good number of years, the softball players are wearing it. That doesn't say, I don't know what it says about girls being more preventive oriented than boys, but it does lead you to believe that.
Yeah. That's great. We've had a fantastic conversation. You're a little bit concerned, Steve. You're like, what are we going to talk about for an hour? But there's an hour. It's just flew past. And we could spend an hour, several hours talking with knowledge. So the ASD, you were there from one of the start. Have you seen it develop much? From you're a member in the 80s, and you're still very active right up.
No, it has changed, and it's like any small organization. It has a lot to do, and this is something you guys kind of need to watch out for in a way. We started in the 80s by a bunch of academics, largely that came from big universities that had big football teams, that started this Academy for Sports Dentistry for mouth guards and treatment of trauma. And that was for a while. And then a guy named Dennis Rinaldi took over from Pittsburgh, and he wrote two, one in 91 and one in 2000, Dental Clinics of North America volumes, which had multiple articles on different aspects of sports dentistry, the female triad, injury rates, blah, 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 all that other stuff. And so we were pretty academic for the first 20 years of our existence. But then the number of practitioners of sports dentistry started to raise the number of our organization. And that was not bad, but our focus changed. Our focus changed to a more practical level. And the number of publications that came out of our group has kind of not kept up with what it was at one time. Every now and then we do. 2015, we had a nice special issue of general dentistry, and then just recently, some of us split with our partners in IDT to write some prevention guidelines, but the literature has been taken over by largely other parts of the world. But now what we have is we have a lot of people that are actually doing sports dentistry that are advising us. And that's kind of interesting too. The other thing is new things in dentistry have taken part. When I started, implants were not a thing. And now part of the ongoing restoration for a high-end athlete involves a lot of implantology, especially if your initial treatment doesn't work. So we have a lot more implantology type of discussion and things like that. So yeah, it's developed, and I'm waiting. I would like a little bit more of an academic perspective to reinsert itself into our group. I'm not that person, but we do have some young people that are, and I would like it to kind of reinsert it into our group a little bit more than we've gotten away from. I don't want to lose that practical aspect, because those guys are really valuable because they do it. You know, they walk the walk, so to speak. But I do think that having a cadre that can put it in print and can bring it to the greater dental population is also really important. So, and then, and it'll go like that. There will be times we'll get people like you guys. I mean, it would be great for us to have two people that are energetic enough to do a podcast, but we don't at this point. Maybe by seeing it, they will say, okay, well, we can do that, so we should do that. And then, who knows, in a couple of years, we might have someone energetic enough to bring us back to the scientific literature in the same way that we were maybe in our inception. But it's just one of those things. We'd like our small organization to get to be a bigger organization, and that might help. Because right now we are still a small organization.
But that's the thing, though. I think it'll take groups like yourself and the UK and the EFOSD and the Baltics to keep pushing each other. Because that's the thing. You also want some, not rivalry as such, but you want some healthy competition to a degree, because that's what will help make you get better. And that's how athletes get better, is by people pushing them to break down barriers and to keep jumping. Because like you said there, restorative dentistry has changed a lot. Implants is now a big thing. We don't know where dentistry is going to lead to. We talk about 3D scanning quite a lot and how that's a big implementation into what we do on a daily basis. So I think that meeting in Washington in a few weeks will be great. Unfortunately, I can't make it this year. But if you could do me a favor, Steve, and if you can just let all the the bars and liquor stores in Washington DC know that John is on his way to be prepared. That would be great.
You should do a podcast from DC, John. Omar, you could hop on electronically real easily. What you said is so great, though, because you're right. Competition does drive innovation. And from that standpoint, it's fine. But this worldwide development of sports dentistry, if nothing else, has inspired cooperation as much as that, and learning from different people. And going to your meeting, I learned so much about sports that I had no knowledge of at all. And speaking with people from India, which is getting to be very active, they bring to the table some information that I had no feeling about at all, but it can all dovetail together. And so I like the idea of competition, but I want the overall message to be of cooperation. Yeah, don't start. Several countries have had this, where you have your group now started in the UK, and Joe Jones down the street might say, well, you know what, I think I can do it better. I'm going to have another UK sports dentistry group. I think that would just be bad, because that level of competition would kind of detract from the cooperation. But I think that what you're saying, the competition across the globe for learning, I think that's nothing but great. I think that's terrific.
Yeah, that's fantastic. I think that's a great way to leave it as well, Steve. Thanks very much for your time. It's great chatting as always. And
I'll see you in a couple of weeks.
Yeah, we can spend days talking about sports dentistry, and we've opportunity to connect in a couple of weeks. So thanks very much for your time, and I'm really looking forward to catching up in Washington in person.
Thanks very much, Steve.
I am too, John. And Umar, just look to 2026 if you can't make 2025.
Oh, we've already planted the seed. We're talking about going to a soccer World Cup match, possibly in Mexico, and then head up to San Diego. So I think we're trying to plant the seeds.
That sounds like a trip.
2026.
Yeah, that sounds like a trip.
And we'll be live.
We'll
be live podcasting. That's our next big thing. Will be live podcasting. So we'll get that sorted.
Yeah, that's right. Well, you guys have a happy Father's Day.
Yeah, you too, Steve.
Yeah, thanks very much. Cheers, Steve.
Oh, you're welcome.
We are delighted to have Ionate as a sponsor for the Sports Dentistry podcast. Are you looking for a water bottle that's built to keep up with your active lifestyle? Look no further than Ionate, the totally leak-proof water bottles with triple lock technology to prevent spills no matter where you're headed. With a simple one-touch opening mechanism, you can sip on the go without hassle. Plus, Ionate's sleek, modern designs are not only functional but can be personalized just for you. Made from high-quality steel, these bottles are easy to clean, and best of all, they're sustainable. From 320ml to 1200ml, Ionate has the perfect size for you, whether you're just out for a jog or going on a long hike. And it doesn't stop at water bottles. Ionate also has travel mugs and flasks to keep your drinks just right wherever you are. Ionate is the official water bottle supplier to the British and Irish Lions on their tour to Australia this summer, and are the official water bottle supplier to the NFL, so you know you're getting the best. I have been using their bottles for a long time now and cannot recommend them highly enough. So head over to www.ionate.co.uk to get your hands on the best bottles in the business, bar none. Now back to the pod.
So that was an interesting conversation with Steve. What's interesting as well is it's really interesting to hear from someone that's such a big baseball lover. It's a little bit like talking to yourself, Umar. You're a big cricket lover. And for us people that maybe aren't into these slower paced sports, possibly, would that be a way of putting it?
Yeah.
Hearing people's passion for it. And when he was talking about his love for baseball and the amount of times, it almost sounds like a cricket from our side, like a cricketer speak, because that's, in my head, they're similar paced sports, and it involves a ball and a bat, or so it was really interesting. That's what I found interesting as part of that conversation.
Yeah, but that's the thing, though. I think he said a lot of people get into sports or into sports dentistry because they love a sport, whatever that is. And we obviously had Byron, who on the West Coast is big ice hockey. And then you've got Steve, who's baseball. and you have the Wheeler who's soccer. So honestly, it just depends on where you kind of grew up and what the sport was in that area that you are. And like I say, Scotland's maybe not known for its cricket, but obviously with my heritage being from Asia, it was a big thing there. And it, there's so many other sports. You know, we're talking. These are all mainstream sports that we're talking about. There'll be people here listening who are maybe into lots of sports that we probably haven't even heard of potentially, or not that widespread or in the mainstream media. That we'd love to hear from here about how they get into it, because as a sport lover, I like to kind of watch all sorts of sports, and we just talked about that there about at the weekend we had the World Cup of Darts, we had the Formula One, we had the rugby finals, we had the Ultimate Test Cricket Championship. We had so many different sports on the weekend, and it's just incredible how much access we have to watching live sport, and it just opens your eyes to what really sports dentistry can be involved in.
Yeah, definitely. And there was actually another sport of the weekend that I was seeing on the socials more, was from our friends in Italy, and that sort of mad soccer stroke MMA match that they
Oh
have in
yeah.
Florence. So I think one of our friends in Italy was at it because in their Sports Dentistry Association page there's lots of videos and photos of action from, I can't remember what the name of it is, but it's I remember watching a documentary on it before, and it's like a soccer match, only there's no rules. You can just start fighting in the middle of it. So it's like that's
Yeah,
a
yeah.
completely different cultural sport. Definitely a sport that sports dentistry would be very very well used in for the athletes post playing. So it was interesting to hear from Steve as well, just the pediatric view on it, and how he talked about the healing and how he feels from a pediatric dentist point of view that would be like a mindset that they would have, that they would really give the teeth as much chance as they can to heal before making sort of like doing treatment that has long-term sort of repercussions of not irreversible sort of repercussions from a long-term perspective.
Yeah, I think the phrase to take away from that conversation was the power of healing, not just about your liver, but but when it
Yeah.
comes to the cells and how we want to try and protect the teeth as much as possible. Because, you know, I always look at it now that I've got a daughter, I'm like, okay, would you not try and do everything you possibly can to see how things will heal naturally? Obviously, worst case scenario is you end up having to do an endo, but with the amazing products we have now, like Biodentine, MTA, maybe not so much because of the discoloration properties of that, but certainly Biodentine, even non-setting classified doctors like Serpil talked about, we have that ability to allow the teeth an opportunity to heal. And that's really a take-home message, is try not be too quick to pick up a bar and start doing all sorts of fancy dentistry, where actually maybe something as simple as doing a cheek pulpotomy and dressing it and just see how you get on. It's just amazing what can actually happen, and what sort of healing and the likelihood of having to do further treatment might actually not be needed.
Yeah, definitely. And just giving that tooth every chance that it has, if it, from example that he said of like a luxation or avulsion, just giving that tooth every chance it can to heal, and then making a decision from there, which was really interesting viewpoint as well. It's interesting as well the chat we had about the colleges system and the school system, and about how that is such powerful way for athletic development. I suppose in the UK it all depends on the sport, but like with soccer you've got all the academies. But then in the US, instead of having the likes of academies, they have everything through the school system and the
Yeah.
college system and things like that. So that's really interesting, and it also gives you a different perspective of how we can have an impact as sports dentists, about who we need to talk to and where the focus would be. So, like, for example, if we wanted to have an impact on the oral health of academy footballers, like the recent study said in the UK about how they have a poor oral health, how we're going to try to change that around. We kind of need to go to the individual clubs and try to talk to the people there. But if that was like if it was the same sort of scenario in America, you'd go to the college and you'd maybe be able
Yeah.
to do multiple sports at the same time by going through that route because colleges maybe be specialising in a number of sports and not just one sport. So it's interesting that way because it gives you kind of an idea of, as a sports dentist, how can we make that impact? And it's slightly different from the scenario that we face here in the UK and Ireland.
Yeah, but I think the impact needs to be made at that sort of age group though, right? So that sort of age group where you're looking at kind of early teens to late teens, because that's where you're going to make the biggest amount of change in terms of habits that they have. If you get them when they're turned pro and they're at these professional teams, you know what it's like trying to change bad habits or old habits. So it's better to try and get in at that age group where they're willing to listen because they've not quite made it at the higher elite level yet, and they're willing to take on board what you're kind of saying. I think that's really something that we should focus a lot on as well. Like I say, in America, you're looking at the high school or colleges. Here, you're looking at the academies, and that recent study that came out is a prime example of that. That we probably need to start targeting the athletes younger, so they're able to digest the information and actually implement that at an earlier age. So when they do make it to elite level, then they should already know what they're doing, what they should or shouldn't be doing. I think that makes sense.
It does, but just from experience like this, what sort of age? What I find a lot is, and even from my own experiences growing up, as soon as you leave the influence of mommy and daddy, as soon as you leave the home house, that's when things change. So I was finding it a lot with patients over the years that as soon as that patient left and went to university or left and moved abroad and then came back, but as soon as they got out of mum and daddy's house and had to be independent and do things themselves, that's when the bad habits started to come in. So you'd have a lot of patients would have went regularly to the dentist right up until they left, and then they're maybe coming in because of a toothache and they haven't been in 10, 12 years. They're now in their late 20s or early 30s, and they haven't been because they've never had any problems, and they just hadn't been because it used to be that their mum and their dad would have organised the appointment and made sure everything was okay. So at what age should we be looking at targeting these people? Like if we are trying to get them at 12, 13, 14, but they're still with mum and dad to maybe 16, 17, 18. And then once they leave that whole environment, then the bad habits start coming in. What's your thoughts on that? Is it that sort of age where they start to become a little bit more independent and they have to do things for themselves? Is that the sort of age that we need to sort of target to try to get them good habits?
You're right. From personal experience, I can tell you about a story, and that rings true from what you just said. Is I was going to Australia after high school, so I was 17, and the flights were booked. I was all ready to go. On the night before I was about to go, my dad said to me, "When was the last time you went to the dentist?" And I was like, I can't remember. It must have been about a year or 18 months or so, because I was high school again, like you said, they didn't have any issues, no problems. And although I was going to dental school, at that point you don't know anything about it. You're applying to do dentistry, you don't know anything about it. So my dad was like, "Well, we need to go to the dentist tomorrow before you go on your flight." So on the way to the airport, my dad took me to the dentist. He's good pals with the dentist. So he phoned him on that evening. He's like, "I was going away tomorrow. Can we book in?" He goes, "Well, why don't you come in before the clinic opens, like half an hour early? I'll see him and just see what's going on. I'm not going to have a lot of time, but we'll do whatever." So I remember going in, and I think one of the only things I've ever had done is like a buccal composite on the lower left 7. So he numbed me up and he did it. It's tiny. It's really small, tiny. And I remember being at the airport, couldn't feel my lip, couldn't feel my tongue, and I'm going away from my mum and dad for a foreseeable time. And like I was excited. So I wasn't upset at all, but I was like on the plane and the boys are eating and I'm just like can't even speak. So I'm like biting my lip and biting my tongue. So like you said, it's like I didn't even personally speak and I didn't even think about it. But then after that, I was like, well, I need to make sure I stay on top of it because I don't want to be in that situation again. So you almost need something that wasn't a negative experience at all, but you need something like that to happen to allow you to then take it upon yourself, because you're an adult by that. I mean, you're still 17. I turned 18 when I was in Australia, but you're an adult, so you make your own decisions. Like you can take a duck to water. Do you know what I mean? So I think it's something where you kind of just have to keep reinforcing good habits, and you just hope that it sticks as they go on.
Yeah, I also find that patients that have had the experience of orthodontics as teenagers or always have better oral health or more aware. And maybe that's because of them regular visits, and maybe that's sort of like a bit of a model. We don't want to see them every 4 weeks, to give them oral health. But it's they're getting at that sort of age. They're getting quite a lot of visits, the dentist or the orthodontist, and that's reinforcing maybe the importance of it. And they always seem to then be very aware of their oral health as they get older. Where for someone maybe that has come right through childhood and teenage years with no issues, maybe might neglect it then because they've had no issues. And is that where we need to go in? Is that the difficult group? Is there anybody that hasn't had the bad experience or hasn't had an experience, is trying to get them to install the good habits in them before they get a bad experience?
Well, yeah, you're right. And I think if you're able to get into a sport organisation at least once or twice a year, even if it's like a 15, 20-minute presentation to show them what could possibly go wrong. I think if you can visually show certainly teenagers, what can happen, what bad things can happen to your teeth and to your gums if you don't look after them. All you need to show them is photos. It's like when they used to put these images on cigarette packets and what can show you when you have cigarettes and stuff like that. The same thing can happen when you can show them, look, this is what your teeth can look like, or your gums can look like if you don't brush it, if you don't look after it, like holes in your teeth, missing teeth. Because a lot of people now, obviously, a big emphasis on social media and self-awareness and how they look and how they come across. So people won't want to have big holes in their teeth or missing teeth or big inflamed red gums or halitosis or bad breath. That's something, if you can highlight what the problems are, what can happen, and the easy things that you can do to stop that from happening. Because to be honest, oral health and oral hygiene is actually really, really straightforward. Like, it shouldn't really be a difficult task to say you need to brush twice a day, spit donors, all the usual sort of stuff, because it's not a difficult thing. It's just getting in a good habit and doing that good habit regularly. The diet side of things is obviously a slightly different thing, but I think general kind of basic self-care, hygiene, like going in the shower and having a wash and all this sort of stuff, it should be accessible, first of all. For everybody should be able to access good oral hygiene equipment like toothbrushes and toothpaste and all that. That should be accessible. So that's also another hurdle. Maybe that's another conversation for another day, probably, about people who may not have access to good oral health equipment or accessories.
Yeah. So if GSK, Oral-B, Sense9 want to sponsor the pod, want to help us promote their products, they're more than happy to do so. Another example I have is when I first started providing mouth guards, just normal custom-fitted protective mouth guards to the local teams in the area. People weren't that interested, and then there was one of the teams locally. One of the players got his 2 front teeth knocked in, just trying to jump for the ball, and his face hit the back of someone's head. And then every player in that team wanted a mouth guard. But whenever they saw the mayhem of him losing his 2 front teeth in training one night, next thing I got a phone call, come on into the club, everybody wants to get a mouth guard. So it's almost trying to get it to the stage where you don't need that experience of either you suffering something or seeing somebody suffering to try to get these habits. But then maybe we find that it's an easier sell whenever you do see something yourself and you see or experience something yourself.
Yeah, definitely. And that's the thing, though. I think we've talked about it a few times before, where you kind of almost need something to happen, like an event to happen like that, for people to stand up and take notice. And I mean, we don't want to be reactionary. We want to be proactive, but that's just the way it is. I think all we can continue to do is continue to educate, which again is one of the big pillars of sports dentistry, is we talked about many times, is education, prevention, screening, and treatment of acute trauma and long-term management. So it's one of the pillars which we need to kind of keep banging the drum about.
Yeah, definitely. Well, that was a good chat with Steve and a good podcast, and I'm looking forward to catching up with him next week. And so it's always good to have a chat with Steve, and there's plenty we haven't touched on there. It's interesting the work that they've done with the Olympics as well. The ASD group was done with the US Olympic teams, and it's interesting how they set up. It's them challenges as well of working with Olympic athletes, and how the different sports have all got their different training camps, and it's not as if they're all there at the same time and you can get just like go in and get everybody covered at the same time. Everybody's on their own schedules and is trying to link in to get everybody covered. So that was quite interesting as well to hear him explain how they've done that.
Yeah, and I think that's something that we can learn from as well and bring that into the UK, because there's so many different ways that we're able to screen and help athletes, but we need to kind of pick up other parts of the world and other organizations and how they're doing it, because there might be some ways that other organizations are doing. We think actually that might work quite well with us as well. So I think we just got to keep learning and keep figuring out because everything always change. Everything's changing, every month by month, year by year. About this time, well, last time we did it this way, and we scanned them in the facility in the ground, but then they want to go and they want to come into practice, or there's other ways of doing it. So I think there's something there for everybody to learn from. And I suppose when you're out there next week, you can ask the questions from our friends out there and see what's new with those guys and girls, and we can kind of see how you can bring that back to the UK and let the rest of us know how they go about things, or if anything's changed.
Yeah, definitely. So the next time we do the podcast, I'll be in Washington. I'm going to have to hook up with you from Washington. So
that's good.
Hopefully Trump lets me in, and we'll be coming live in Washington.
Yeah, I look forward to hearing your stories, mate.
Yeah, so it's good. The last time I was in Washington, I've been quite friendly with Conor McGregor's boxing coach, and Phil Sutcliffe Senior. He was a double Olympian back in the 80s. He's a great character, but he went out for the inauguration because Conor was out, so he was out with it, and he was just sending me these videos, of Elon Musk doing all this stuff, and so it was a bit mad. So that was the last time I had somebody contact me from Washington. So I'm quite looking forward to it, because it's what Washington's. It's always like any movie, and you talk about America, you always see the White House, so you see some famous sort of part of Washington. So looking forward to see the sights and catch up with the sports dentistry colleagues over there. So if anybody is thinking about coming, even if you want to come for one day, get yourselves out to the Thursday to the team dentist course, or even pop out the weekend and catch up with everyone. It's always a great conference to meet people and to network.
Yeah, lucky guy. So pass my regards on to our American colleagues. I look forward to touching base when you're in DC.
Yeah, I think that was Trump listening in just to see.
Did you hear that?
If I'm allowed in.
Did you
Yeah.
We're being tapped. I think
we're being tapped. We're being tapped. Yeah. I must check if my ESTA form has been approved yet or not.
Oh yeah. For the listeners out there, some sort of mad frequency just came over in the headphones. Both John and I was like, "What's going on there?" Must be Trump's listening.
Yeah, that's it.
Yeah.
Right. Until the next time, Umar.
It's good to chat. Okay, you too, mate.